So I would say the number one health concern for men, as it is likely for women, is the risk of cardiovascular disease. It continues to be one of the most prevalent diseases as we get older, and one thing that many people don't know is that men are actually at higher risk of developing a heart attack much earlier on in life than women are. That's why it's really important that men see their doctor regularly, that they get their regular annual checkups, that you're talking about risk factors and things like that with your doctor, so that you're able to optimize lifestyle and prevent cardiovascular disease as you get older. So I would say that the number one thing you can do to stay healthy and prevent disease is to stay active and just keep moving no matter what age you're at. The recommended amount of physical activity for adults is 150 minutes of moderate intensity aerobic activity per week that can be divided up as, whatever seems fit for you. And moderate intensity means that, you're either going for a brisk walk or a light jog or weightlifting, something that's gonna get you a little bit out of breath and that's gonna make it difficult to carry on a conversation. So there's a number of things you can do on your own between your regular yearly doctor's visits. Depending on your age, if you're a man in your 20s to 30s, you can do regular monthly testicular exams looking for any hard nodules or lumps or anything that's different from previous. You can also keep an eye on your skin, do checks from head to toe, looking for moles, anything that looks out of the ordinary or that changes, as the months go by. And I would say the final thing you can do, especially as you get older, is checking your blood pressure regularly. This can be done at home, at the supermarket, at the pharmacy. They oftentimes have little blood pressure cuffs set up there. And you can check your blood pressure, and if it's anything higher than, roughly 120/80, go to see your doctor to talk about, that more. What many people might not realize is that checking your blood pressure in these settings, whether at home or at the pharmacy, can in some cases be more accurate than checking at the doctor's office, because you don't have the stress of getting there or the busyness of trying to fit that visit into your day. We tend to be a little bit more calm and relaxed when we're just shopping at the pharmacy or at the local supermarket. So your prostate is a gland that's located just below the bladder and just above the testicles. It's about walnut size. And its primary function is to secrete fluids that combine with sperm and aid in reproduction. However, for men, the prostate can also cause many problems at various times in your life. If you're on the younger side, it could be prostatitis, where you get inflammation of your prostate that can cause symptoms similar to a urinary tract infection. That can happen as you get older. As you get older, you can also get gradual enlarging of the prostate through something that's called BPH, or benign prostatic hypertrophy. And that can cause urinary symptoms such as having to go to the bathroom frequently or feeling like your bladder is not able to empty completely. And then, of course, age 55 is when we recommend starting to screen for prostate cancer, potentially earlier depending on your risk factors. So if you think you've been exposed to a sexually transmitted infection, the first thing you need to do is go see your doctor. Your doctor can help get you tested as soon as possible, oftentimes even before you may develop any symptoms. And in some cases, you can even get treatment for that infection before the test results come back. It's important to do this sooner rather than later, also so that you can prevent any transmission of this infection to someone else. And it's important to complete the full course of treatment as well before you become sexually active again.